I'm alive! Hey guys, welcome back to my channel. If you're new here, welcome. My name is Ivy, and here I post all things nursing school, skincare, and my life. So I am officially done with my second semester of my accelerated nursing program, and I thought first semester was hard, but second semester was by far the most stressful semester. And it isn't because of the material per se, it was more because, you know, my program's already accelerated as it is, so imagine trying to condense it even further in a summer semester where there's less weeks in the semester, so it's already like less time as it is. So it wasn't so much the material that was hard, it was more so trying to get everything done in such a short amount of time. You guys probably noticed that I haven't been posting on my Instagram. The last time I posted was on June 10th, which was basically when the semester started. Honestly, it was because it was just so hard to keep up with social media. There was so much going on. Like, I had assignments, exams, so much readings, so many lectures. It was hard trying to juggle both. So this semester I took Adult Health 1. Some schools know it as Medical Surgical, Med-Surg. I also took Pharmacology, Psych, Research class. Last semester I believe I took 5 courses. This semester I took 4. However, we had more clinical rotations this semester. So I think they were both pretty hard in their own way. Like, semester 1, we had a little bit more time in the semester, but there were more classes involved. Whereas this semester, we only had 4 classes instead of 5, but we had more clinical rotations and we had way less time to get everything done. So I'm going to talk a little bit about things that I learned this semester, things that I wish I knew before the semester started, so that you guys are aware when you take these classes. So let me start off by things I wish I knew before the semester started. I already knew that I wasn't going to be able to attend family gatherings, hanging out with friends and whatnot. That was something that I already kind of knew going into the semester, considering I already got a taste of it from last semester. But this semester I literally did not go out. I feel like the summer just flew by. I was constantly studying. I wasn't able to hang out with family or friends. There was only one time where I did hang out with some friends for a barbecue, and even at my friend's house I was still trying to get some work done. Like, he let me use his room and I was doing some assignments and stuff and drinking from the solo cup and stuff just to try and get some things done before I went back to hanging out with friends. The other thing that I didn't realize until the semester started was that we don't get any breaks. At least during semester 1 we had a spring break. This time around it just went straight through. There were no breaks and the pace was so fast, way faster than semester 1. I think that was part of the reason why we felt so burnt out towards the end, because it was just non-stop work. We would finish an exam and we were already thinking about the next exam. Sometimes during lecture we were completing all of the material that was going to be on exam 2 while still trying to study for exam 1, because we hadn't even taken exam 1 yet and we were already completing exam 2 material. In terms of the hardest class, I don't think there was necessarily a hard class. I think it was more of which class had the most work involved. I was stuck between adult health and pharmacology. I think though if I had to choose between the two, it would have to be adult health, only because each exam had so many chapters involved and trying to get through all those chapters and all the material was just a lot. Pharmacology also had a lot of information as well, but I think pharm was very straightforward compared to adult health. Like, adult health, the questions sometimes were pretty tricky. You had to really know the material, what exactly the question was asking, because sometimes you would look at a question and you had to really think, okay, what is this question asking? My favorite class is probably pharm. I actually really enjoyed pharmacology. It was a tough class, don't get me wrong, it was pretty hard. You had to make sure you studied and stayed on top of it. It was one of those classes where the exams, the questions was like, you either knew the answer or you didn't. Like, you had to know your stuff. But I actually really enjoyed it, I really liked it. I understand so much about medications now. You know, like, we go about our day and like if we get a headache, we just take a Tylenol, or we take an Advil, an ibuprofen or whatever. But now I actually understand the difference between each one. I understand the mechanism of action. I understand the side effects, the contraindications. It's very interesting to learn how each drug affects the body and how the body responds to it. It was very interesting. A lot of the material that we learned from Patho last semester came up this semester. A big tip for you guys is to seriously pay attention to your Patho class because it came up a lot this semester. I actually referred to my notes from my Patho class last semester a lot when it came to pharmacology and when it came to adult health. Pay attention and try and do well in that class because it will really help you for the following semester. So let me talk a little bit about adult health. Adult health was more of like learning about different diseases, learning about how it affects the body, understanding the disease state, the different tests that are done to be able to come to a diagnosis, the different treatments, the different medications, and basically what we as nurses can do to help the patient overall. Adult health went hand in hand with pharmacology, and it was great because a lot of the chapters that we were learning in both classes kind of went hand in hand. So it was kind of like we were learning similar things in both classes, and it helped us understand each class. So for example, when we were learning about the cardiovascular system in adult health, not only were we learning about like the disease states, how to diagnose it, the different tests that we do and the different treatments that we do for each type of disease, but in pharmacology we were also learning about the specific medications that are used for each disease. So they kind of went hand in hand, and it really helped us understand each lecture because we were learning about the same things in each class. Not only that, but sometimes understanding the mechanism of action in pharm helped us understand how that specific medication treated that disease. So when we were learning about it in adult health, like it all clicked and it all made sense. One of the things I learned, which I feel like a lot of people should know about this. You guys have probably seen those like charcoal drinks that people have been drinking. Drink this, it's healthy or whatever. However, did you guys know that those drinks can actually affect the medications that you could be taking? It could affect how those meds are being absorbed in your system. So let's say if you are taking birth control and you're drinking those drinks, it could be affecting the way your birth control is being absorbed and how it's working in your body. So you have to be careful, you have to be mindful of the things that you're consuming while you're on meds. Psych was also very interesting. I feel like this class and the clinical rotation, it was a very humbling and eye-opening clinical rotation. So we learned a lot about therapeutic communication. That was like the biggest thing in our class. And we also learned about different mental illnesses, and we also learned a lot about different medications that are given to patients that have different kinds of mental illness. And again, this class sometimes kind of went hand in hand with our pharm class. Also, another thing about pharm that I found very interesting and exciting too was that I found myself understanding more medical shows. Like whenever they mentioned a drug or some kind of procedure, I understood what they were talking about. Or even just like when I was reading the newspaper, sometimes they would mention like different medications. Like recently I saw a New York Times article that was talking about this specific drug that I had just learned about, and I was like, oh my god, like I know what this is, I know what it does. So it's just exciting realizing like, wow, like in such a short amount of time I've learned so much, like I understand these things now. And it's, it's exciting because it's like I'm learning. Finally, research. Research I actually surprisingly enjoyed. A lot of people weren't a fan of it. The class involved understanding how research is conducted, and we went in depth learning about the differences between quantitative and qualitative research. Personally, I really enjoyed it because if you know me, I'm a nerd and I love reading journal articles, especially when it comes to dermatology. I like reading about new and upcoming technologies in the dermatology field, and I feel like this class really helps me understand these articles better, because even just the wording that they use can tell you whether the article is a quantitative study or a qualitative study. Alright, let me talk about clinical rotations. I got to go to 2 rotations. One was for psych and one was for adult health. Adult health was honestly very exciting. I got to see different units, including the cardiac step-down unit, the CT-ICU, which was by far my favorite, the ER, the ICU, oncology ICU. I was all over the place. I got to see a little bit of everything. The CT-ICU was by far my favorite unit. The nurses were so smart. The nurses were incredible, and they were so sweet. Like they were very, very willing to teach us and explain different things to us. And they even let us participate in like different procedures, administering medications. So it was very fun. I feel like I learned so much this semester in this clinical rotation specifically, especially since it was in such a big, well-known hospital. And also our preceptor was basically a big manager in the hospital, so she was able to get us into like all these different units. I mean, she was the boss, nobody really questioned her, so we got to see a lot. Alright, so the second clinical rotation, like I mentioned before, was psych. It was very eye-opening, very humbling, and I realized that mental illness is just so misunderstood. Like, I realized that medications really do help. I literally saw patients one day without medications and how badly it was affecting them, and then after they were administered certain medications, how completely different they were and how much the medication actually helped them. I was able to rotate in the pediatrics section of the psychiatric hospital dual. So dual is basically when a patient has a diagnosis of a substance abuse and mental disorder. I also was able to observe in something called court, which is basically where we see the doctors, the nurses, the healthcare professionals talking with the patient's lawyer, because a lot of legality goes on when it comes to being a patient in a psych unit. So I got to see like the legal aspects of that. One of the first things we had to do as students when we arrived at the hospital was to get fit tested for a mask. And I'm going to show you guys the one that I got. So I had to try a bunch of different masks, and in the end, this is the one that fit me the best. It has this jelly part right here, it has a filter, and they gave me replacements for the filter. So the reason why I had to use this mask was because the regular N95 mask didn't fit my face properly. They said that my face is too small, so I don't know if you guys have seen this, but they basically put this huge hood over your head and they spray this like chemical into the big hat. You can see what it tastes like, and it has like a very, I don't know how to describe it, it just had like a very bad taste. So then they would make you wear the mask and they would put that big hood over you again, and they would spray the same thing. They basically make you do that over and over again with different types of masks until you don't taste that thing that they spray anymore. And yeah, for me, this ended up being the mask that helps me pass the test, and this is the one that I had to use if I ever came across a patient that has some kind of airborne precaution, or just, you know, to help protect myself. Okay, so now I'm going to talk about how I tackled this semester, how I was able to get good grades, and how I stayed on top of all of the material that they gave us. So the most important thing, in my opinion, is to stay organized, and planners are the way to go. So my favorite by far is this one by Day Designer. I used to use the tiny ones during my prereqs, when I was taking my prereqs. This is from 2020. I threw out all of my older ones, but I just wanted to show you guys that they have like small version, they have this large version. This is like twice the size of it. But this is the one that I've been using now while I'm in nursing school. And what I like to do is that I actually print out my schedule. I have my schedule here, but I'm not gonna show it. So what I like to do is I like to print my schedule, and then I just slip it in the front part here. There's like a little slip, so that I always have my schedule here and I can always refer to it very quick. And I just like the way this is formatted. So the monthly calendar is very helpful because it just shows you like the different dates, and I like to put like all my deadlines here. So that's actually the first thing I like to do at the beginning of every semester. I go through all of the syllabus or syllabi, would it be syllabi? And I write down all the deadlines, and then they also have a weekly calendar, so you can kind of like plan out your assignments and everything that's due by week. I also like that it has like a little quote at the bottom, like an inspirational quote. It's a very good planner, and it also has like a bunch of folders, like pockets, and it also has like a bunch of stickers here that you can use to put inside the calendar. So yeah, I highly recommend this. This has been my go-to since my undergrad, throughout my prereq classes, and now throughout nursing school. If you guys are interested, I do have a link down below. You can find this on Amazon. I think they sell it at Target too. Another thing that I used this semester was, again, the Saunders book. I basically used this to kind of like get an overview of different topics that we were learning about in class. So the way I would prepare for the week was to check and see what topic we were learning about that week, and then I would search on YouTube under Registered Nurse RN for that specific topic. She has such great videos where she goes over the general concepts. So I would first watch that so I can have like a general overview of what we were learning about, and then I would supplement that with the Saunders book just to get a little bit more information. Then I would attend lecture, take notes on whatever the professor said, and my professor would always give us like the specific table numbers or diagram numbers that were in the textbook. So I would go back into the book and look at those specific diagrams and tables. Most of the times it was the ones that had to do with like nursing interventions. You guys should really focus on those boxes in the textbook that have to do with like nursing interventions, anything that has to do with like nursing assessments and things like that. Definitely focus on those, because that's where a lot of the exam questions tend to come from, just because they really want us to understand what we should be doing as nurses in the future. So this was very helpful, once again, just like last semester. And if you guys are interested, I'm gonna leave a link down below for this too. Something else that I always did also was to prepare everything for clinic the day before. Like, I made sure that my uniform was hung up and ironed and ready. I made sure my book bag was ready. My lunch was packed in the fridge, so all I had to do was just grab it and put it in my lunchbox. Because in the mornings, when you're waking up at like 5 a.m. to be at the hospital really early in the morning, you have to make sure that everything is ready to go, because you're gonna be tired and you're trying to beat the traffic. So definitely prepare everything the night before. Don't wait till the morning of to go looking for stuff, because you're gonna end up getting to clinic late. Another thing that I used this semester, once again like last semester, was Notability. I still use this app. This app has been so helpful, and I also love that I can upload all of my PowerPoints and my notes on here, and I can take it on the go. So if I'm ever, stuck somewhere like at a doctor's appointment waiting to be called, I can always just study while I'm waiting. Very convenient, and it's just been so helpful. I definitely recommend it. It was so helpful last semester for patho. It was so helpful again this semester for actually all of the classes. I used it for adult health, for pharm, and for psych. So if you guys haven't looked into it, I definitely recommend it. I think in my last video I actually also recommended it for your prereqs, because I remember using this for my microbiology and my A&P classes, and it was super helpful. And finally, one of the things that I'm going to recommend is to definitely have a good group of friends that will help each other out and that are willing to get together to study. It's good to have a group, because sometimes one person catches something that somebody else missed and it ends up being on the exam. Sometimes, when you explain something, it'll help somebody understand it better, and vice versa. Alright, so next semester, I'm going to be taking OB, pediatrics, and adult health too. And I'm super excited because I really want to see what pediatrics is like, what OB is like. I've never seen that kind of environment firsthand, so I'm super excited. I think I'm gonna end up liking it a lot, because I love working with kids. Like, I'm very good with kids, so I'm excited for that rotation, and we'll see how that goes. So if you guys have been to these kind of rotations before, please leave your comments down below on what you learned and things that students like myself can do to prepare. Alright guys, and that is it. I hope you guys found this video helpful. If you liked the video, give it a thumbs up, and if you like this kind of content, then definitely hit subscribe down below. And if you don't follow me on Instagram, then definitely head on over and check that out. And I hope to see you guys in the next one. Bye!